Hello everyone, I'm Niamh O'Donnell, part of the Life Sciences team at Gate 1 and host of today's episode of the Life Sciences in the Spotlight series. Today's conversation is around patient centricity and the importance of patient partnerships. According to an Ipsos study, 91% of pharma employees believe they are patient-centric, but only 15% of patients believe pharma are patient-centric. So it's clear that there's a real gap here that must be addressed, and I'm excited to delve into this a little bit more with our guest today. I'm here with Asla Kujibrahimoglu, Global Patient Partnership Leader at Roche across nephrology, rheumatology and IBD. She's been with Roche for the past 3 years, where she works to define impactful solutions that really deliver value for patients. Every time I've caught up with Asla, her passion for ensuring the patient voice is heard and acted upon in pharma is palpable. A quote you recently said, Asla, and I hope you don't mind me repeating this back, but it really stuck with me. You said that meeting with patients gives me energy. It doesn't feel like work at all. And I really loved that. So welcome. Thanks for joining me on this episode.
Thank you very much for the wonderful introduction, Niamh. I'm really thrilled to be with you today and talk about this very, very important topic, which happens to be both my work and passion, as you were saying.
Excellent. Well, the feeling is totally mutual. Thanks so much for being here. So we'll kick off then the first one, Asla. In the context of partnerships, which is obviously the space you work in, what's your definition of patient centricity and how has this evolved as a concept and as a practice in the past decade?
I think one thing first is that we need to acknowledge that patients are really becoming increasingly empowered to be active participants in their own care and treatment options based on their own unique experiences. Pharmaceutical companies like us and authorities, for example, FDA and EMA, are increasingly evolving and listening to patients. However, it is important to note that we as pharma cannot or should not make assumptions about what the patient community wants, needs, or expects today based on the historical data that we have. So our approach at Roche is really built on the core philosophy that everything we do for patients, we do with patients as partners every step of the way. And patient community really helps us to bridge gaps in our understanding of patient perceptions, preferences, and experiences. I think that way we can really develop solutions that add value to patients. For us, understanding the patient perspective is about understanding the every aspect of the patient journey, the burdens that patients face, the trade-offs that they have to make when selecting a treatment, of course, their preferences for dosing and how the medicine is really administered, their view of potential side effects, how they access the medicines, and the short and the long-term impact these treatments have on individuals' lives. I would say what has been really evolving as a concept or a practice over the last decade across the industry is that we move for patient partnership from being an access and advocacy driven function to a function that is really integrated. Far earlier in the drug development life cycle, partnership with the patient community used to be based on one-way flow of information. So we are trying to move away from those transactional relationships to partnering and having co-creational relationships, because we as a company believe that through our collective work, we will have a greater impact on healthcare systems. And so to recap that, we move towards early and systematic patient involvement. So we've seen that this approach brings the most exponential benefit for both us and to the patient and society at large. We work to incorporate these considerations into all stages of our R&D efforts through these close collaborations, whether it can be our standing patient councils, or through the inclusion of patient experts in our clinical trial committees, or through the review of our clinical development plans, trial designs, or protocols. I think the ultimate goal of these efforts is to engage in a dialogue and work together every step of the way.
That dialogue is so key as opposed to that one-way transactional way that you mentioned earlier on. Asla, it might seem obvious to some folk, but I'd love to know in your own words, what impact does that early inclusion of the patient needs, wants and desires in the life cycle have on that asset development?
I would say there are many benefits in early inclusion of the patient voice in the drug development phases. We engage with the patient community and bring in their perspectives much earlier in the life cycle of our innovations because we know that by doing this, we can truly shape the way our medicines and diagnostics are developed so that they meet the needs of the patients who will ultimately use them. Systematic and consistent patient engagement at the discovery and early development stages provides a really strong rationale to prioritize investments and build molecule development plans that can really bring value to people living with a condition, hence have a higher probability of success. Our work to learn from patient community and make the right investments and decisions has to start early. We strive to really embed the patient input throughout the life cycle of our innovations, from the earliest phases of development and continuing through the whole development process to really shape our thinking and strategies at a disease area level, therapeutic area level, and an organizational level. By incorporating these learnings into our early development plans, we really aim to design studies that answer the right research questions so that we can streamline our development processes and accelerate timelines to bring meaningful innovations much faster. And this is how we create the highest possibility value for the patient community and, of course, society at large. I would like to give an example. In one of our clinical trials, we had, for example, 10 clinic visits in a 10-week period. We heard from the community that it was quite burdensome for some patients to come in every week for a half a day because a visit requires, of course, good amount of tests and blood work. So hearing this feedback what from that we received from the patients, we consolidated everything in one full day. Then of course we heard that now patients are quite stressed out because they're having to spend the entire day in the site and they're going through a lot in a day. So while we had successfully reduced the number of clinical visits in our trial based on the feedback, we had created another challenge to enable participants to only come into the clinic once a week. We had like really bundled several tests and physical assessments into one visit, making it a longer duration. And in some cases, this resulted in a greater financial burden for patients, of course, with participants now having to spend more than half a day at the hospital, costs associated with parking or transportation arrangements. Of course, they are increased as the need to make provisions for example, things like childcare, meal expenses, and all those other things. So when our study team heard this, they took it to heart and worked with service providers to really build additional support into the trial, reimbursing participants for trial related travels, meals, as well as childcare expenses to simplify the reimbursement process. Our goal was to eliminate as much of the financial burden as we have from the trial, while also making it fit into the lives of the people who will ultimately participate in it. I think this is just one of the many examples where patient inclusivity has helped to improve our clinical trials. So, the work we do from a community perspective is helping the organizations to balance what is right for the majority of patients and who are in our trials. So, I would say, in short, this would be like the early inclusion of the patient voice to the life cycle of a drug development has so many benefits. And we are at Roche really working to change this whole narrative from really making it early and as systematically as possible.
Thanks so much for that example, Laszlo. And what are patients expecting and needing now more than ever? And how do you think pharma companies can meet or even hopefully exceed these expectations?
I think the crucial points are really listening and co creating together. Patients are increasingly empowered to be active participants in their care, as I've been mentioning. They are the best place to tell us what their needs are. Patients and patient groups are more equipped than ever to define healthcare in their own terms. The core of our work as pharma is listening to patient community needs and really translating these insights into patient inclusive solutions. It is this partnership with patient communities that we have talked about will really enable us to truly personalize healthcare and evolve the way we look at diseases. And we're committed to being open and transparent with patient organizations and partner with them in a way that reflects our devotion to improving the quality of the life of patients. And we believe that transparency is really critical throughout this whole partnership. So, a healthy partnership includes mutual value, equity, trust, and respect. And as long as pharma can deliver on these things, I think patients and patient organizations are expecting these very crucial commitments and pillars from the partnerships that they have with us.
And I suppose looking at the non-traditional ways that pharma can support that, what do you think has been the impact of digital innovation on the patient experience, and how do you see this evolving over the next 5 years, say?
Well, it is no brainer that digital healthcare and patient centered care are deeply related concepts, and that overarchingly, digital transformation has really the potential to improve access to care. The pandemic, of course, has undoubtedly accelerated the transformation. When face to face encounters become constrained by the pandemic, the number of virtual encounters really soared. And with social media, with social network, as more and more content is available on the World Wide Web, it really blurs boundaries. So patients do not have to rely on their own physicians, practitioners, or their families or their networks for information. So patients now have access to information about all cutting edge information innovations from a diagnostics and integrated health solutions in the treatment perspective. So digital has made it really possible for patients to become very self-aware and give the access to information that would inform them what would work for them. So giving them more control in their healthcare decisions, in their care, in their treatment, in their disease management. So they're more involved and proactive in their care because they have the information they need accessible. So patients today want more customized experiences that meet their individual needs and provide better outcomes. And digital transformation meet this demand, of course. It's about using technology to optimize and support each aspect of the patient and clinician experience to achieve even better outcomes because we have now the borderless information. I mean, one example would be the rare diseases. When a patient gets diagnosed, the first thing they do is, of course, they go into the World Wide Web to look at some of the networks to better understand what are their options regarding the treatments or clinical trials. So it is a way that patients find their own options, their own groups where they are able to talk about the disease, the management, and other important topics. So there, with the whole accessibility comes a lot of misinformation, especially on the internet and in the social media. So as an industry, we work very closely with patient advocacy groups to really make sure that we have the correct and most up-to-date information. And we need to note that pharma needs to be very aware that we can rely on traditional ways of interacting with patients. Healthcare system needs to evolve to make those types of digital solutions the norm. And my story as a patient, in 2020, I got diagnosed with an autoimmune disease called Graves' disease. One thing that I vividly remember from my diagnosis time is how I mean, of course, I don't want to blame HCPs. I know, they have a lot of patients to look after and they are working in a very rigorous schedule. But when I got my diagnosis, I was in the doctor's office for only 2 minutes and I wasn't given a lot of information. I was just told, okay, like you have Graves' disease, you need to do every 3 and 6 months checkup with me. Here are the medicines you need to take, and this is what you're going to deal with your whole life. I couldn't even hear the name of the disease. So it was like really a moment where I even asked the HCP, oh, like, can you please write it down for me? Because I don't understand, like, I cannot hear it. And the HCP was like writing it down for me. And then I was out of the doctor's office for after the 2 minutes, as I said. And I got diagnosed with a disease that I will have to manage my whole life. Like it's an autoimmune disease, there's no cure, you can only manage the disease. And I vividly remember how hopeless I felt, how it was hard for me because at the time COVID was also happening. So I didn't know what I needed to do, how I needed to deal with this disease, what I needed to change in my life. So, of course, what I did naturally is being also Gen Z, I went directly into the web. I wrote the name of the disease from the piece of paper that the HCP gave it to me. And I started looking at some of the information, what there is out there about the disease, how I can manage it, or some of the local and global patient organizations where I can maybe connect with some people who already have this disease, whether they get recently diagnosed or whether they have been dealing with this for 20 years. So that was the first thing I did as a patient as soon as I left the doctor's office. Of course, another part is, empathy, right? Like I was having a lot of struggles when I was talking with the HCP because I felt like I was being brushed off in a way. As I said, like I know HCPs also go through a lot of problems. Of course, they are looking after so many patients. It is like I'm never in any way blaming any healthcare professional, but I would like to iterate my own experience as a patient. What I was also looking for from these like local and global patient organizations was empathy. Just have someone or a group of people to talk to about my disease and get even mad about, the things I cannot eat, or getting mad about how many pills I need to take throughout the day, or talking about how there is no cure for it. Just this way of like connecting, this way of like having this empathy. I think that was given to me by the local and the global patient organizations rather than the HCP. And I'm as I said, I'm iterating. I'm not expecting this, of course, as a patient, but I think as a human and as a person, when you get diagnosed with a disease, you learn that it's going to affect your whole life. You expect an empathy or a little pat on the back or just a little conversation rather than just being there in the office for 2 minutes and giving a paper that says what the name of the disease is. So I would say like digital helped me a lot as a patient. I was really looking for a lot of like information on the web. I was connecting with a lot of patients, caregivers to better understand my disease. Of course, some of the other topics as like safe pregnancy or like managing the disease via lifestyle changes, because diet was very important as well in my disease management, or taking some of the supplements that needed to be done. So I think these were all came from the digital connections that I had in the global or the local patient organizations that I found through my search on the web. So, as a patient myself, I've been using and I'm still using web to really connect with different patients, caregivers, to really also better understand my own disease and my own diagnosis and all the treatment options that I have. So, it's really helpful as a patient to be able to access these informations without having to go through HCP trouble or going to the doctor office looking for information or to the hospital.
Asla, that is such an impactful and insightful story. Thank you for sharing that from a personal perspective. I wonder if you don't mind me asking, how are you now? I mean, 3 years on post diagnosis, do you still find that you have that opportunity and that space to vent, as you alluded to, and that space for compassion and empathy that you perhaps didn't find when you first went for that diagnosis? Are you still tapping into that digital space? You mentioned it already. Is it still providing that network and support that you need?
Yes, definitely. I think it is still a big chunk of my life where I connect with people who are dealing with thyroid diseases. And it is really important for me because maybe, now dealing with this disease for a 3 year mark, I can also be a mentor as a patient to help another patient. And I think that's very important to remember to give back because I remember the confusion, I remember the frustration I had. And I think like it is extremely important to remember those days and talk with other patients who maybe just recently got diagnosed, or someone that they love got diagnosed and they don't know how to support their loved ones. So I'm still in the area, I'm still in my local and global patient organizations as an active person. Likewise also in Roche, because we have an internal also support system for patients. So I think like it is incredibly important for me to not forget the feelings I had when I first got diagnosed, and to make sure that I'm also someone who is giving help, giving a hand to those who are experiencing similar things, or maybe feeling confused, maybe feeling frustrated. Sometimes it is okay just to be frustrated together, even if you don't have a solution, right? Just to have that kind of coming together and just talking about the situation. So I'm still quite active, as I said, and I will continue to be as long as I can do that. But I think it is very important that we should make the patient voice the center of our decisions, our solutions, everything we do in every step of the way, as I said.
And you are the perfect person to do that. And that's why we are in this industry, right? It's because we care. And I love how you're applying your personal experience into your day-to-day in pharma to make patients' lives that little bit easier, and to ensure that patient centricity is really at the forefront of everything we do. So, Asla, thank you again. Some excellent insight you've provided over the past few minutes, and really, really appreciate you sharing your personal story too. Thank you.
Thank you very much.
So that brings this episode to a close. We are wrapping up with Asla on patient centricity as part of Life Sciences in the Spotlight podcast. Thank you for joining again, Asla, and thank you everyone for listening.